Hello, this is Dr. Kamel and a new content related to the physical therapy license exam preparation. My name is Dr. Kamel. If you didn't see on any of my videos before, I work as an associate professor in United States, and I'm a licensed physical therapist in United States and in Egypt and in the UK. I have got my PhD from University of Nottingham in the UK. So let's go to today's content. During an intervention session with a patient with recent onset of hemiplegia, so the patient had a stroke and it is a recent one, a physical therapist plans to focus on transfer to and from a wheelchair. This is our goal, transfer training from and to a wheelchair, bathtub, and automobile. Which of the following methods should be most effective for long-term retention of these skills? We know that stroke will affect the motor function, sensory, cognitive, depending on which area of the brain is affected. Okay. And as part of our motor learning strategies, we need to understand how is motor learning is working. Okay. So what we should do, practice the activities in random order. So this would help more retention of what have been learned, or sequence the activities from easiest to most difficult. This is another approach. Allows the patient to determine the sequence of activities. So I give the patient the freedom to decide, which activities need to be done. Although this is a recent hemiplegia, might be that the patient, does not have the full judgment or, of decision making regarding these functions. Establish a predictable but variable practice sequence. Okay. So, what is the best strategy in motor learning in order to improve motor learning and retention of skill? The answer is one, practice activities in random order. Okay. This question is asking about motor learning principles, especially uh, how to, when you practice, what should be the schedule of this practice, and how we can facilitate long-term retention of this motor skill. So for patients, in order to learn functional skills after this neurological injury, after this stroke, recent stroke, random practice will be the best. Okay, why? Because it will lead to better retention of the information and better transfer of learning. So, two main aspects, better retention, better transfer of learning, and in addition to improving the ability to perform skills in real life environments. Like here, we are trying to transfer the patient in and out of a wheelchair or to the wheelchair and away from the wheelchair, a bathtub, automobile. So these are, you know, daily life activities and real life environment. Okay. So in the beginning, the patient might not be doing the best. Okay, we might have errors in performance, and the performance, might not be worse in the beginning, which is acceptable. And as the patient is practicing wheelchair transfer, bathtub transfer, automobile transfer, things will improve. Okay, these functional tasks, when we make them in random practice strategy, this is the ideal situation to improve retention and transfer of learning later on. Let's look at the incorrect options. But before we look at the incorrect options, let's talk about the key motor learning principles. What we mean by random practice. Okay. So in random practice, we are actually practicing tasks in unpredictable order. So there is no preset order or predictable order. It is unpredictable order. Example: bathtub wheelchair transfer. car transfer, bathtub transfer, then wheelchair transfer again, okay, and so on. So this is unpredictable and order, okay. This will improve and create high cognitive engagement, will help problem solving, will help motor planning adaptation, and overall this will improve the long-term learning and retention of these motor skills. How about the incorrect options? How about if we do sequence the activities from easiest to most difficult? Yes, it seems logic, and it would be useful in early rehabilitation in order to improve confidence, improve, reduce frustration, especially after this recent stroke. But on the long term, this will not maximize the long term retention as if we do random practice. How about another incorrect options? Allow patient to determine the sequence. Yes, we respect patient autonomy, okay, which might improve motivation for the patient because the patient is feeling that, I am the one who is making the decisions. But, this will not improve the motor retention, and there is no evidence that this can improve motor retention. Option number four, establish a predictable but variable practice sequence. Okay. So predictable means blocked practice. So we have certain sequence of practice which we will not change, which we will not alter. Yes, this might improve the short-term performance, but will long-term or retention will not be the best. Okay, like if we do all while wheelchair transfer first, then all bus transfers next, then all automobile transfer. So this is immediate performance might be improving short-term retention, but on long-term retention, it will not help. So now we have two main types of practice: blocked practice, and this is good for early skill acquisition. Patients who are severely impaired patients, so they will not be able to practice random practice thing, and it is good for initial understanding. But it has a poorer retention, and it will not help much on the long term retention. Random practice, on the other hand, is better for retention, for transferability of this acquired skill or newly learned skill, and for real world function, because under the real world function we are doing motor activities in random practice. Sometimes I have to use my wheelchair, then I have to go to the automobile, I might be back to the bathtub, sometimes I have to use the bathtub and back to use my wheelchair back to my bed, and so on. So it's random practice, okay. So now, the critical factor to summarize improve learning is a subject must do something different on consecutive trials. Even in a study, when we are studying for the license exam, we encourage in the beginning blocked practice, like we are practicing questions on cardiopulmonary, then musculoskeletal, then neuromuscular, then we do a mix, which is random practice. Okay, so the traditional approach for retraining by practicing one skill repeatedly is not the most effective. Okay, on the long term. So having the patient practice number of tasks in random order would probably be more successful for long-term retention. Okay, and that's why this is a correct answer. If you would like to join my PT preparation exams course, please send me a message on either of these WhatsApp number 0014422487206, 00201027743702. I would like to thank you for watching and following my content, and if you kindly can share this content with your colleagues will be much appreciated. Thank you and see you in a new content.